Hello, y'all.
This is Chris Richter, and I'll be talking about the required diabetes education and information about diabetes. Hope everybody's doing well. All right, let's dig down into it. Type 2 diabetes is a disease that affects 1 out of 10 Americans currently. According to the CDC, it kills 80,000 people a year. It's something that can be controlled, though, with knowledge, healthy lifestyle, and exercise. 80,000. That's a lot of people. Let me ask y'all something. How many people do you think type 2 diabetes affects? Well, according to the CDC, as many as 1 in 3 Americans are going to be affected by type 2 diabetes in the future, 2050. That is, if I hold my fingers up representing people, 3 people here, one of those people is going to have type 2 diabetes in 2050, according to the CDC. So what is type 2 diabetes? Type 2 diabetes is caused by having too much sugar in our blood. The doctors refer to this sugar as glucose here. Too much sugar for diabetics is toxic. It can kill your organs, and it's very toxic to your internal system. Okay, so where does glucose come from? Glucose comes from sugar. Sugar is another term for glucose, okay? Sugars or glucose come from food that we eat. Our bodies break down all the sugars and starches that we consume and convert it into glucose. Our bodies need this glucose in order to fuel our cells with energy. So basically our energy is coming from this. Our energy is what we're putting in our mouth, okay? Type 2 diabetes is caused by having too much sugar in our blood. That's what it comes down to. Glucose levels can become too high for 2 different reasons. The body doesn't have enough insulin. The insulin hormone that the body uses to carry the glucose in our blood to tell our cells for what to do with the energy doesn't work properly. Okay? So another reason would be the body does not use insulin correctly. Those are important to note. The most common form of diabetes, there are 2 types of diabetes, is type 2 diabetes. According to doctors, 90% of their patients are type 2 diabetic. And only 10% are type 1 diabetics. And this type 2 diabetes is preventable, which is kind of alarming because 90% is coming from something that we can prevent. How do you tell if you might have it? There's some frequent things that people might notice. You might urinate frequently, have excessive thirst, excessive hunger, blurry vision, okay, tingling in your your hands and your feet, which can lead to neuropathy, and later on leading to amputations. It could cause dry skin, sores that don't heal and won't heal, frequent infections as well. Could you be, you could be pre-diabetic and not even know it, or diabetic already. In order for us to figure this out, we have to go to the doctor and ask for, basically it's called a hemoglobin A1C test. This is a test that measures the average glucose level in your blood. If your results range from 5.7 to 6.4%, you are pre-diabetic already. Okay? If your results are 6.5 or higher, you're diabetic. So, what can we do if we are diabetic? There's some things we're going to talk about in a little bit. Okay. Some of the causes of type 2 diabetes is one very important cause is our lifestyle factors. A lot of people live sedentary lifestyles, poor eating habits, and lack of healthy eating and exercise knowledge. We need to focus on knowledge, exercise, and a healthy lifestyle, not sedentary. All right? Sometimes we can't help it. Our genetics or family is predisposed to type 2 diabetes. We can't choose our genetic background, unfortunately, but we can help prevent it by doing these things. Okay, some major complications of type 2 diabetes is heart attack and stroke, which can lead to death. Of course, that's a serious matter. Kidney disease, which your kidneys filter your toxins in your body. okay? And our eyes, very important for us to see things and get things done. It's hard to not have your vision. It can affect that. It can have nerve damage, neuropathy, possible lower limb amputation again, skin conditions such as inflammation, ulcers, diabetic foot syndrome, which is what I'm about to show y'all, a picture of diabetic foot syndrome and an amputation. So this next image is going to be graphic. If you need to turn your head, just do that right now. Okay, here we are. Here's two different outcomes due to type 2 diabetes. As we see here, this is the diabetic foot syndrome. And look, here's the ulcer. It's not healing due to the diabetes, type 2 diabetes. That's gruesome. Okay, we don't want that to happen. Here's another scan of an amputated leg due to type 2 diabetes. We don't want any of this to happen. That's just horrible. Okay, so we can have courses now. There are courses for this type 2 diabetes. The CDC wants us to know that type 2 diabetes most often develops over the age of 45, but this is important. More children, teens, and young adults are also developing it currently. We don't want this to come about in our future kids if we ever have them, or anybody in our family that's young. And it's coming about more often, so we need to take charge. Okay, we need to know what our local community has to offer, such as courses, pamphlets, and websites. Some community courses are very important for the safety of us and will give us further knowledge on diabetes. Courses on healthy lifestyle, of course, as we said. Suggestions and plans for diet and low-calorie eating. That's very important. Here's an example in our backyard. It's called the Coastal Bend Health Center, and it's through our university, okay? Texas A&M University. You can go directly to their website, and it's in our backyard. We can get this information locally, and they have handouts and classes to teach us education more on the subject, and you can follow their guidelines. Very important, and it's free. Open to the community too. Okay, here's some other things we need to know to equip ourselves to have our sustainably healthy lifestyles. Of course, we have the education diabetes courses, but one thing to note, and it's a good source to use, is the CDC handout. It goes through in detail a daily basis of what you can do to prevent this type 2 diabetes. It tells you what to eat, tells you how much to eat, and it tells you kind of a basic life outline. It's almost like changing your life if you're not used to it. I lost 100 pounds by just doing this. Suggestions in this. It's very simple, and it's a fun lifestyle to live, and you feel great afterwards. So, to further go along with our education courses and why we need them, it'll give us the tools that we need and the information for type 2 diabetes. The handout from the CDC Center is what I suggest, but you can find others that might work for you. I just know that this works well and it is clinically proven, okay? People need to know how to live healthy lives, and proper education courses will save their lives and save people's lives in your lives, and could possibly save your own life. In conclusion, we know the causes now of type 2 diabetes. We know the signs and the symptoms. And we know some of the complications of the disease, which are pretty graphic, and we do not want that happening to us, okay? We have our sources. We know where to find them locally. And we know how to combat this disease before it happens. We want the fighting chance against this disease. 1 in 10 Americans, again, have type 2 diabetes currently. But in 30 years from now, 3 out of 10 people will have type 2 diabetes. Like I said in the beginning, that is a significant number. My challenge to you, is to count the number of people in your family. If you have 10, you have the potential to save 3 lives in the future. Okay, one more thing. It's simple, and it can change your whole life and save others' lives, especially if our whole community changes the way they are. I want you to be active, eat right, and change a sedentary lifestyle for our future generations. Don't be scared if you're living a sedentary lifestyle right now, or if you currently have diabetes. It's not something to be scared of. We can take care of it, and don't be embarrassed about it at all. It's a common thing. My references I pulled from the American Diabetes Association, which is a great website where you can get information on type 2 diabetes and helpful guides and stuff like that. And of course, I suggested, as on the previous slide, the Coastal Bend Diabetes Education Center in our local backyard. Okay, and there's also the handbook that I got from the National Diabetes Prevention Program, which is a handbook, which is a very great guide. And my pictures I got from basically a stockpile, typing in diabetes, type 2 diabetes. All these references are very proven, and these trials that we've mentioned in here and statistics are all mentioned by the CDC and the National Diabetes Prevention Program, as well as the Coastal Bend Diabetic Education Center. Y'all have a great day. Stay safe, y'all, and hopefully y'all